I am here today as a proud representative of National Nurses United to ask that Medicare for All be included in the platform as a core principle of the Democratic Party. One of the critical roles of a nurse is to be a strong patient advocate. Today, I am here to not only advocate for Medicare for All, because it would benefit my patients, but also because I'm a patient myself. My story started a year ago when I had a life-threatening incident. I was treated and placed on disability, and after a year, I thankfully resumed working, but not before I completely used up all my life savings to cover my bills during this time. So even though I have insurance through Covered California, our state ACA exchange, financially, I just had no margin of error to get sick. I'm a single mom raising two sons, one of whom has autism. Autism alone can be financially devastating, but my sons have prospered, and however, there's nothing left over for a medical emergency. Currently, I pay my health care premium, but I can't afford to use my insurance. The costs of my life-saving medicine and my necessary lab work are out of my reach. I understand the struggles of my patients because, like them, I too have put a Band-Aid over a hemorrhage. Because I cannot afford health care in the United States, I've been forced, to the extreme situation of driving across the border into Mexico to get affordable care. When in Mexico, I drive to the doctor's office building, I park and I walk past the many heavily armed guards who are there to protect the doctors from being kidnapped in order to get my care. And last time I went, I was detained while a bomb squad cleared the building. Still, when I faced the reality of not having the money to pay for my health care, I fortunately had an alternative to our expensive ACA plans, and I was able to purchase medical care through MixInsure. It costs $75 a year for medical and dental coverage. I can now afford to see a doctor, pay for my medicine, and get my required lab work and tests at 1/5 of what I would pay in the United States. While they're not up to U.S. standards of care, something is better than nothing, and right now it is keeping me alive. I'm also delivering petitions today of 21,000 Americans who are joining nurses and calling you to boldly lead by making Medicare for All part of your platform, by including the language of the AFL-CIO that they adopted at their 2009 convention.